Hi, this is Dr. Karen Becker, and today we're going to discuss diarrhea. It's really not if your pet's going to ever have diarrhea, it's when. And although it kind of seems like a weird topic for videos, believe it or not, a lot of you are going to be watching this because if you have puppies or kittens, you want to prepare yourselves for when your pet has diarrhea. And those of you that have had adult dogs or cats, you're well aware that it's unavoidable. It's just going to happen. So having good information beforehand is always important, or if your pet is in the midst of a bout of diarrhea, hopefully you can derive some good information on how to manage it. Causes of diarrhea are incredibly vast, really, very, very vast. Most commonly, we see dietary indiscretion, which is the fancy word for dogs and cats eating things that they shouldn't, causing GI upset. A sudden change in diet can do it. Infectious disease, such as parvovirus, is well known to cause diarrhea. Parasites, every type of endoparasite can cause loose stools, intermittent GI upset, and diarrhea. Food allergies. We typically think of food allergies when animals eat foods that cause excessive itching. We'll call that food allergies. But really, the best descriptive term for a food allergy is what veterinarians call inflammatory bowel disease or irritable bowel syndrome. Both of those diagnosed diseases have a common side effect of having intermittent loose stools or diarrhea. Foreign bodies. So if your kitty eats a rubber band, even though it's not blocking the lumen of the intestinal tract, it can still cause quite a bit of diarrhea. If your dog eats sticks or bark, that can cause diarrhea or intermittent loose stool. Pancreatitis, inflammation of the pancreas, as well as feline hyperthyroidism, both well known to cause diarrhea. As does stress. Stress-induced diarrhea can occur when peristalsis, that motion of the GI tract moving food downward, is upregulated because of secondary stress, and that can cause stress-based diarrhea. It is important to know that symptoms of diarrhea can be quite diverse. In fact, of course, frequent urgency and loose stool or watery stool is classic signs of diarrhea. But straining is something that a lot of my clients actually inadvertently come in telling me that their pets are constipated, when really what they see is after an explosive bout of water being passed, their pets stay hunched up, trying to pass more feces, and nothing's coming out. So owners believe that there's potential for constipation when indeed it's an episode of diarrhea. So you need to be aware that sometimes you can be tricked into thinking your pet's constipated when really there's diarrhea. Cats, easy to determine, you check the box. Dogs can be a little bit more difficult, so if you see your dog outside hunched up, you need to go evaluate. If there's liquidy brown stool or water being passed, you need to be aware that probably the culprit's more diarrhea than would be constipation issue. There can be additional symptoms of fever, lethargy, malaise, dehydration, loss of appetite, all common with diarrhea episodes. Usually, young, healthy animals have one episode of loose stool or diarrhea. It's self-limiting and they're done. However, you can also end up with animals that become quite debilitated and ill from chronic bouts of diarrhea. So puppies and kittens, small dogs, and geriatric animals are all at risk of dehydration from even a single episode of diarrhea. If your pet appears fine and healthy after a bout of diarrhea, you can monitor them. However, if you begin to see lethargy, or certainly if you see your pet have a fever or not acting well, it's worthy of a vet visit. If your pet is acting fine, but you just have one or more episodes of diarrhea that doesn't seem to be resolving, you may be worth visiting your local veterinarian at a non-emergency situation. When it's serious and when you know that you need to visit the vet quickly is if your pet begins passing blood, or if you notice that your pet becomes weak or debilitated secondary to having multiple bouts of diarrhea. All important aspects to be able to visit your veterinarian fairly quickly, if not immediately. So if your pet is healthy, has one episode of diarrhea, is acting fine, our recommendation is to withhold food, not water, withhold food for 12 hours, and then begin feeding your pet a bland diet 12 hours later. Now, my idea of a bland diet is fat-free and, of course, bland, neutral. So my recommendation is going to be cooked ground turkey because it's fat-free, and canned pumpkin, or right now there's a pumpkin shortage, you can use cooked sweet potato. Many old-time veterinarians will recommend ground beef and rice. We don't recommend that anymore. Ground beef is way too high in fat, and rice, actually being a complex carb, is much too fermentable. And although the rice is bland and does contain some fiber, because it's fermentable, not only do you end up with gassy pets, but you tend to see the rice being passed out whole in the next bout of diarrhea. So we recommend canned pumpkin, cooked turkey, mix 50-50, and you'd feed this bland diet until the diarrhea resolved. If your pet's diarrhea isn't going away in about 3 days on a bland diet, you need to consider talking to your veterinarian. I do recommend that you consider having slippery elm on hand. Slippery elm is a neutral fiber source that's excellent at slowing down episodes of diarrhea. We give dogs and cats about half of a teaspoon per 10 pounds of body weight at every bland meal. And so slippery elm is a great addition that's kind of nature's Pepto-Bismol to help reduce GI inflammation and provide a bland source of fiber to help slow down how quickly feces are moving through the GI tract. If you need to visit your veterinarian because the diarrhea is progressing, I do recommend you bring a fecal sample with you. You need to collect some feces with a piece of stiff cardboard, a small amount, maybe the size of a quarter, put it in a Ziploc baggie and bring that with you. Your pets will be thankful because otherwise your vet will collect a stool sample, and that's not as pleasant as you bringing one in for your dog or cat. Your veterinarian will end up, if you bring your dog or cat in, will end up probably doing some blood work to determine if there's an infectious component. They'll probably give fluids to replace any dehydration problem that could be going on. They'll take your pet's temperature and make sure that if there's a fever, they're addressing it. And then, of course, do a fecal check, sometimes bacterial checks on the feces to determine if there's a viral or bacterial issue causing the underlying reason why your pet has the diarrhea. Prevention, of course, is the key when it comes to recurrent bouts of diarrhea. If you have a young puppy, it can be really hard because that puppy, every single time it goes outside, it's getting into grass, mulch, sticks, rocks, dirt. So supervision is actually quite important. If you have kitties that obsess about your houseplants, supervision is quite important. Young animals tend to be much more inquisitive about their environments, and they tend to eat things that they shouldn't. So making sure, I tell people all the time, puppies and kittens are the best stimulus for a really clean house because you're able to remove all of those paper clips and paper towels and things that will have dropped on the floor. If you're dropping food when you cook, and if you have a pet that has a sensitive stomach, you want to make sure that you are doing what you can to collect morsels. Now, I will tell you this. If your pet has a strong, resilient GI tract, which would be my hope, your pet should be able to eat different foods and not have blowout diarrhea, just like you're designed to eat a different breakfast every day and not have blowout diarrhea. So I give my dogs a different food every day for 14 days, and their stools are great and wonderful because I've conditioned them into having strong, resilient GI tracts. If you fed your dog or cat the same food day after day, month after month, year after year, and then you up and switch their food, you'll have diarrhea. And it's not the food's fault, it's because your pets have a monotone gut. So if you're going to wean your pet onto a different food, you have to wean very slowly. 10% new food, 90% old food for several weeks sometimes, then 80-20, 70-30, 60-40, 50-50. But the goal is to wean slow enough that you've got no bowel changes. It's also important that you keep your pets out of garbage, that you not let your cat lick fry pans that are sitting on your stove. All of those can contribute to episodes of diarrhea. Most importantly, diarrhea can cause some cramping and GI upset. So in addition to slippery elm, many people end up having other herbs such as peppermint or chamomile, even homeopathics such as podophyllum on hand to be able to help reduce some of the side effects associated with intermittent diarrhea.